latest weather, traffic, and news updates online at 560theanswer.com. Now, from the Signature Bank Studios, this is Chicago's Morning Answer with Dan Proft on AM 560. The Answer.
Top of the morning, Dan Proft here. Trump and Mark Cuban making nice. It's easy to make nice with Trump. You just have to start complimenting him and fall in line. And that's what Mark Cuban has done as it pertains to Trump RX. Trump returning to a discussion about affordability when it comes to things like health care and specifically prescription drugs. Had a confab that featured Cuban and others who are promoters of Trump RX, which, of course, Trump called the hottest thing in medicine right now. It's hot.
Since that launch in February, TrumpRx.gov has already been visited more than 10 million times and has saved American consumers over $400 million already, and it's really the hottest thing in medicine. It's been amazing. I asked Dr. Oz, how's it doing? Bobby was there. He said, nobody's ever seen anything like this, so it's great. People are saving a lot of money. Over the next 10 years, the Council of Economic Advisors estimates that our most favored nation drug policies will save Americans over $500 billion. And this has been the greatest breakthrough in lowering health care costs in modern history.
And Trump went on to talk about the addition of more generic drugs to Trump RX. So it's growing, and that means the savings gets passed on to you.
We're increasing the number of drugs available on Trump RX by nearly 7 times, adding over 600 affordable generics to the website, working with industry partners. Cost-effective generic drugs are often available at just a tiny fraction of the price of their brand name equivalents, and in theory, they're the same thing. Sometimes they're better, with the same dosage, the same effectiveness, and the same active ingredients, yet many consumers do not think to ask for them. They don't know about them. By incorporating this massive catalog of low-cost generics at TrumpRx.gov, consumers will now have one source to ensure that they're getting the lowest possible cost on their prescription. So they have a real option now. Today, they have something that they've never had before. They've never had anything like this or even close. With these additions, Trump RX will feature the best and lowest prices on prescriptions used by tens of millions of Americans already. And in some cases, the discounted generics available through Trump RX may be offered at an even lower cash price than the out-of-pocket insurance cost, which has always been the lowest, but we're going to be lower. This means that the TrumpRx.gov should always be your first stop before you go to the pharmacy to pick up your prescription.
Well, Mark Cuban was all smiles, praising the president for Trump RX.
Mr. President, I think other than you, I've been the biggest proponent of TrumpRx.com. And the reason for that is Republicans want cheaper drugs, independents want cheaper drugs, Democrats want cheaper drugs, and together, I think we're going to do something special. What makes Cost Plus Drugs different is that when you click through Trump RX to our site, not only will you see a great price, but you'll see our actual cost and that we only mark it up 15%. And what makes this incredible, Mr. President, all the volume and all the people that are going to come from the site, as our volumes go up, our costs go down, which means we'll be ending up charging less to people over a period of time. So this is a special announcement. This is a special partnership. 559 of those drugs are ours, so we're really excited to be part of this. Thank you so much for having me.
You're listening to a guy who's not a big fan of government-private partnerships. They rarely go well. They rarely offer what they promise to, and it's just none of the government's business, frankly. The things that government shouldn't be involved in. So let's separate some fact from, some fact from fiction in terms of what was said, because I think some of the things that Trump said don't actually square with reality. And this is coming from a Trump supporter, but he is healthinsurancementors.com first. See Stephen Tucker, founder and principal broker, healthinsurancementors.com. the most knowledgeable man about health insurance in the Western world. Stephen, thanks for joining us. Appreciate it.
Good morning, Dan.
Trump RX is unprecedented. Nobody's ever seen anything like it. Is that true?
Maybe the website name, which Mark Cuban incorrectly called TrumpRx.com. So that's new, TrumpRx.gov since February. But, the truth is, GoodRx.com is running TrumpRx.gov. And the thousands of discounted prescriptions that are available at GoodRx.com have been around for many, many years. My clients have been using them. Millions of Americans around the country have been using those discounts. So it really is nothing new. The website itself is new, TrumpRx.gov, not .com, and it links, of course, now to Mark Cuban's site, which has about 600 generic drugs that you can use, which is a welcome addition. But it's basically now kind of like the central hub. You don't have to open another browser window and go to GoodRx.com. The exact same prices at GoodRx.com are now at TrumpRx.gov, as are the 600 generics that Mark Cuban offers through his SaveRx.
Well, so is it just a convenience factor? It's not a force multiplier in terms of cost?
Well, I think that's really the whole purpose here, right? If Mark, obviously these two men have not been fans of each other for a long time, but they're resolving their issues, I think, in Mark's case, in an effort to drive down prices even farther, because as he stated correctly, if you have millions more people aware of this and they're using a federal site now, then the cost due to utilization, of course, will drive down prices even farther. At least that's the goal that Mark Cuban is stating. And I think it's possibly achievable, but it is certainly nothing new.
Would it be better from a policy perspective to eliminate PBMs, the middlemen, altogether?
Yes, and I've said that for a long time, but I think even more important to that is to address the 340B issue. And this is something that I think Cuban has spoken about once or twice. The president hasn't addressed it, but that is really a grift that has happened since the expansion of Obamacare. The 340B was developed in the early 1990s, and it was to help these underserved communities, places where hospitals, were set in place to help those who did not have a lot of income. And so those hospitals specifically that were supposed to serve underserved communities would get drug costs for half the price. And so the manufacturers of those drugs would give those hospitals those drugs at half the price, 50% off, which is a tremendous discount. And so along comes Obamacare, and that program has exploded by 74% utilization from where it was pre-Obamacare. And so now what's going on is not only are underserved hospitals in underserved communities, but hospitals like our own Northwestern and the Henry Ford Health Center in Detroit, and all these areas in wealthy communities are now benefiting. The hospitals are taking the discount and upselling the cost of those drugs to all of these affiliated pharmacies, some of them as far away as Hawaii, and charging people with private health insurance more for the cost of drugs, which is driving up the cost for brand name drugs specifically. And there's hardly any oversight as to where this money is going, and it is billions and billions of dollars. Hospitals, for example, are now building new centers with their 340B revenue because nobody is watching it. And so that's something the president should address right off the top. And I haven't heard him speak about it at all.
Do you think, just looking back on it, going back to the George W. era, do you think that Medicare Part D was a mistake? That we would be in a better place with prescription drugs if not for the entitlement and the government the government, the associated government pricing and centrally planned infrastructure?
I don't know about that, Dan, because the cost of these drugs due to these scams, everybody, by the way, should read the 340B grift in the Wall Street Journal, a brilliant article that exposed all of this nonsense. But when you have schemes like this going on, where the costs of brand name drugs and specialty drugs are ridiculous, thousands and thousands of dollars a month, and you have sick seniors, for example, that can't afford that, I think the Medicare Part D program has been a huge benefit for those people because, there's caps on what they can spend out of pocket. So I think it's been a huge benefit for seniors in this country, not a harm, but a benefit. But do I think the free market would work better without schemes like 340B and without Obamacare, Medicaid expansion? Of course.
Yeah. Well,
yes.
Yeah.
But
Yes.
these things exist, and we have to live in a reality.
No,
That
I
is the
know.
reality.
No, I concur. I'm not saying that you can just pull that Jenga piece out of it. I get it, but I'm just saying, thinking about this as sort of a lesson in public policy making and markets versus central planning. If you had, it's one of those. If you had to do it all over again, would we have done Medicare and Medicaid and then all of the bolt-ons over the last 65 years the way we did them? And I would argue no. I wanted to give you an opportunity. I know we had one of your favorite people on last week, Dr. Zeke Manuel. Have you picked up his book about the 6 simple rules for healthy living yet?
No.
All
no,
right.
I have not. I don't plan on it.
All right.
My stomach turned during that interview.
Well, I like to challenge people's intestinal fortitude when they listen to the show. So I asked him about this inflation tax associated with Obamacare that you mentioned. The Wall Street Journal opined about, and his basic response to the surtaxes that are not indexed for inflation and are sort of hitting more middle income taxpayers each year. Some of what we talked about last time you were on about the premium spikes that people are feeling.
My God, yes.
That he said, well, of course we need to revisit it. You set something up 15, 16 years ago, and you got to continue to, maintain it. You got to make sure you do your diagnostic testing, and you got to make sure you, put new tires and fill up the windshield wiper fluid and all those things to make sure that it's still a finely tuned machine. So we just need some updating of it, and maybe that would include the indexing of those taxes. But by and large, Obamacare has been a wonderful innovation, and it just needs a little bit of tweaking.
Yeah, sure. I would have loved to have been in your position during that interview with Dr. Zeke. I would have asked him a couple of questions, like, does he think it's good that nationwide we have lost 146 health insurance companies in the individual marketplace? Does he think it's good that the state of Illinois and the state of Michigan are the only 2 states left in the entire Midwest that offer PPO policies in the individual marketplace, and all the other states only offer restrictive HMO policies? Does he think it's good that the cost of the cheapest bronze plan for a couple in their 50s now costs $2,400 a month with a $10,600 deductible? Does he think it's good that due to Medicaid expansion, we have these grifts like 340B that I mentioned, where it was supposed to help people who can't help themselves, and now, of course, it's making hospitals rich and driving up the cost of prescription drugs, especially brand and specialty, for everyone, not just those who have insurance, but those who don't have insurance and those in Medicare and Medicaid. So I would have had a lot of questions to ask Dr. Zeke, but unfortunately I was not the host that day.
Fundamentally, I wanted to hear more about like his, being a cyclist and making chocolate at home. Those are the topics I'm more interested in. But is the fundamental problem, which always turns out to be the fundamental problem, with the first thing you said, that it artificially consolidated the sector through government coercion effectively.
Yeah.
And so you don't have a competitive marketplace. And when you don't have a competitive marketplace, these sorts of price spikes, rationing, oligopoly pricing essentially occur.
Yeah. And of course, the elimination of so many other insurers that could drive down costs, right? I mean, we know the basic principle, economics 101, that, you're to drive down prices due to helping competition. But, we're in a position now in the state of Illinois where we have basically one monster, and that's Blue Cross Blue Shield of Illinois, that offers a PPO. They've eliminated all their competition. We've got a handful of other carriers, and I mean a handful, like 4, that offer restrictive HMOs. And that's our only choice. We don't have any other options. And then you add to that Governor J.B. Pritzker, who has demonized non-Obamacare health insurance, known as short-term health insurance, calling it junk insurance for many years, specifically because it doesn't cover pre-existing conditions. You have to understand that in free states like Indiana, or even lesser so Wisconsin and Iowa and all the states that surround us, I have clients who are paying half the monthly premium that they pay with Obamacare. With about half the deductible, they are able to lock their premium in for 3 years, thanks to President Trump, with short-term health insurance. And unlike the Blue Cross PPO, they have national PPO coverage, which is impossible to obtain under Obamacare any longer in the individual marketplace, specifically because President Trump allowed people to buy non-Obamacare health insurance, specifically short-term health insurance, and lock it in for 3 years instead of only 3 months, as it was under President Biden. And so because they live in Indiana, where it's run by rational Republicans, they actually have affordable health insurance, Dan, and they don't have to worry about rate increases for 3 years. It's locked in for 3 years. So is it bad because it doesn't cover pre-existing conditions? No, it's not bad. If you don't have pre-existing conditions, it will save you a veritable fortune. But it's nice to have those options. We don't have those options in the state of Illinois. We have Obamacare and Obamacare only.
Mm-hmm. And just updating a story we've talked to you the last couple times you've been on. I know that there was a problem with the state's website, where that's just where you had to. Yeah, I'm understating it slightly, but I mean, but remind us what the issue was, why this is unique to Illinois, and where things stand with this problem that Illinoisans were having with signing up for health insurance here.
Yeah, so we taxpayers paid $1 billion to perfect healthcare.gov, and it does work perfectly now. It took 16 years, but it does work perfectly now, and it has very little glitches or problems. Applications are completed quickly, and it's been working great for about 15 of the last 16 years. We can no longer use healthcare.gov, even though we taxpayers in Illinois and taxpayers around the country paid $1 billion to perfect it. We must now use what, in my opinion, is the worst functioning website I've ever had the displeasure of being forced to use, and that is getcovered.illinois.gov. Not only does it crash 18 to 22 times when you're trying to complete an application. Now imagine that during open enrollment when everyone is panicking to try to get their health insurance by the cutoff date, right? But then it was also responsible for, and now they're blaming Blue Cross, but during this transition, we had all these seminars. It's all going to be great. We've really upped our technology and everything's going to be fantastic. It was an unmitigated disaster because people did what they were supposed to do. They paid their premiums, right, early in December to get a January 1st effective date. And by the middle of January, some of them into March did not have health insurance because the premium was never transferred from getcovered.illinois.gov to Blue Cross. And it was just an unmitigated disaster, totally unnecessary, didn't have to be done, but now we're all forced to use that site. And you can ask anyone who's had to use it, even those who work at getcovered.illinois.gov, what a disaster it is. And I don't see any improvements in, what is it, almost June? And it's still crashing.
That's really it's really surprising because J.B. Pritzker, as you know, is a very successful tech entrepreneur.
Of course.
So I'm really surprised to hear that that's been so challenging. But the real problem, though, you talked to us about before, was the premiums that get transferred. So you paid, but you didn't actually have coverage. And so has that been remedied for your clients?
Oh, it finally has. Yeah, it took until about the 4th week of March, and their quote unquote ticket was elevated to emergency level, and they finally got health insurance. But of course, by that point, you have to pay January, February, and March all at once. What a pleasure.
Well, part of the privilege of living in the land of Lincoln, I suppose. One question from 847, just because this is something Trump has promoted to, and I didn't ask it. He talked when he had these confabs with the pharma companies, the Oval Office, and so forth, not dissimilar to the one he had yesterday. Well, we're talking about, we've basically put the arm on the pharma companies, and now we're getting the same drug prices as other countries were getting. Is that a real thing? Was there a real discrepancy, and now there's real savings? Or at the end of the day, does it go back to what you said? GoodRx was providing the prices before TrumpRx. It's just basically a new facade on the same program.
Well, we won't know because the president gave Pfizer a 3-year waiver from his tariff, right? And so we're not really going to know until 3 years from now because Pfizer is operating completely, and Pfizer is gigantic, obviously. They are operating completely outside of those new tariff requirements. But as I have said all the time with these kind of price controls, these are things that we would expect from Democrat presidents, not from Republican presidents. And price controls are always bad, as you and I both know. Mm-hmm. But in this situation, we're not going to really know the end result of it. But my concern is when you do this most favored nation, right, situation, which eventually may drive down costs even further in the U.S., there's a couple things that happen. Pharmaceutical companies stop selling drugs in countries where those drugs are desperately needed by people. Honestly, they're not Americans, obviously, but they still need access to those prescriptions. But if you force the cost of drugs to be most favored nation status, in other words, it must be the cheapest if sold in the U.S., then pharmaceutical companies, and there's evidence of this already, they just stop selling those drugs in those countries, right? And so how many lives are impacted negatively because of that? That's one of my primary concerns, as I said from the beginning, when you do this kind of price control.
See Stephen Tucker, founder, principal broker, healthinsurancementors.com. CS, thank you as always. Appreciate it.
Thank you, Jed.
And CS Tucker joined us on the alphawealthgroup.com answer line.
This is Chicago's Morning Answer.
Your show keeps me alive during the week. There's nobody I'd rather listen to between 5 and 9 in the morning than you guys.
On AM 560, The Answer.
Memorial Day is more than a long weekend. It's a time to honor the men and